Delegation is a co-lead at Hep United with the Association of Asian Pacific Community Health Organizations, APCHO. We are excited to present today's webinar on the global movement to eliminate viral hepatitis. Hep United is a national coalition to address the public health challenge of hepatitis B, which is the leading cause of liver cancer and a major health disparity among Asian Americans and Pacific Islanders. Hep United's goal is to support and leverage the success of local community coalitions across the U.S. to increase hepatitis B awareness, screening, vaccination, and linkage to care. Today, we will discuss the efforts of the World Hepatitis Alliance to address viral hepatitis worldwide. The World Hepatitis Alliance provides global leadership and supports action to reduce illness and death associated with viral hepatitis and improve lives. Through advocacy and policy work and building capacity among worldwide partners to raise global awareness, the World Hepatitis Alliance is helping to ensure that viral hepatitis gets the priority it deserves. Before we get started, I wanted to review a few housekeeping items and let you know how you can participate in today's webinar. You may dial into the webinar using the phone option, and the call-in number is shown here. Your PIN number is shown after you join the webinar. Please note that all attendees today are in listen-only mode and will be muted during the presentation. You may submit questions in writing during the presentation by typing them in the question box on your GoToWebinar control panel. We will be reviewing the questions as they come in, and we will hold the Q&A period after the presentation. Finally, today's webinar is being recorded. You will receive an email with a link to view a recording of today's presentation after the webinar. I am very pleased to introduce today's panelists. Joining us as presenters today are Charles Gore, President of the World Hepatitis Alliance and Chief Executive of the Hepatitis C Trust, and Dr. Sue Wong, who is an executive board member for the Americas region of the World Hepatitis Alliance and is also Medical Director of the Center for Asian Health at St. Barnabas Medical Center. And with that, I am happy to turn it over to Charles.
Thank you very much indeed. Jerry, I'm delighted to be part of this. And I'd like to, in the next sort of 15 to 20 minutes, give you a brief run-through of what the World Hepatitis Alliance is about, where we are right now, and maybe what we can all do together going forward. So I've entitled this Viral Hepatitis Advocacy because really, that's what underlines everything that the World Hepatitis Alliance has been about, except for right at the beginning. Sorry, Jerry, you just need to tell me one thing. How do I advance the slides on this?
You should have controls, Charles.
Ah, okay, I do now. Yeah, fine, thank you. So to go back to 2006, the situation then was that generally viral hepatitis awareness was extremely low. The priority in terms of global health was almost none. As you know, hepatitis was not part of the Millennium Development Goals, consequently was not included in the Global Fund. The cohesion amongst the community was extremely low. We had tried in Europe to set up a sort of hepatitis day on October the 1st, but only was Europe and Australia really involved with that. And in terms of global public health leadership, particularly from WHO, there was none. Out of the 8,000 staff at WHO, not a single person had hepatitis in their job title, which I think is enormously telling. And we were stuck in what I like to call the cycle of inaction, where you don't have any awareness, and as a result you have no priority because nobody's making any noise about this. That means you have no funding. As a result of that, well, one of the results of no funding means that no surveillance gets done, so you don't have any data. There's no data to push people for action, and there's no action, and part of that is awareness raising, so you have no awareness. So what happened was that beginning of 2007, we invited all the patient groups we knew around the world, which was far from all of them, but it was a fair sample, to send a representative from their particular geographic region. And the question was put to them, do you want to do something about this lack of awareness? And everyone said, yes, we do. And what we want to do is to have a World Hepatitis Day. And the date was picked in May largely because there are already some things going on in May in the US, also in Latin America. It's a good time of year. It also coincided with the World Health Assembly, and we wanted to draw attention to the World Health Organization about the lack of action. And then we needed an organization actually to run World Hepatitis Day, and so the Alliance was set up right at the beginning only to do that. And obviously since then it's grown enormously, and just to give you a little flavor of it, we have more than 200 members in 80 countries. And the board members, there is one from each WHO region, and Sue, who's going to talk to you shortly, is for the Americas region, are elected, they are patients, and they are unpaid. And this is to ensure that we don't have conflicts of interest, that we represent the patient view, and that the entire organization is dedicated to looking after patients and advancing their interests. And one of the things that was decided right at that beginning meeting was that we were going to deal with viral hepatitis together, not B and C separately, let alone A or E or Delta. And because the case was so much more compelling if you put them together for action at national level. And the Alliance is a bottom-up organization. It really is about service, not control. And it's my role to support our board members, and their role to support patient groups in their region. And of course, for patient groups like, I suspect, some of those listening, it's, as you know, about supporting patients and those at risk. And we are not about control and telling people what to do. And the first problem we encountered was that many people came back to us after the first World Hepatitis Day and said, we cannot get our governments to take part in this. And they're using it as an excuse, the fact this is not an official day. And we literally decided we'd have to find out how to make it an official day, which turned out to be getting a resolution through the World Health Assembly, getting all the member countries, there were 193 then, there are 194 now, that are members of the UN, to accept a resolution making this an official day. And so we wrote to every country and then lobbied with some of them consistently. And oddly, in some respects, our first 4 champion countries stepped forward. Brazil and China, you can understand. Afghanistan and Oman, well, it was difficult to know exactly what their reasoning behind this was. Didn't matter. They put it on the agenda, which is the first thing you have to do. Then a resolution was proposed by Brazil, and we wanted one to be much more comprehensive than just about World Hepatitis Day. And so a reasonably comprehensive resolution was introduced, was adopted in 2010, and it made World Hepatitis Day only the 4th disease-specific official day. There are actually 7 official WHO days, so World Cancer Day is not an official day, for example. And of course the other 3 disease-specific days are the other big infectious diseases, HIV, TB, and malaria. And Article 3.1 of that resolution requested WHO to establish with member states guidelines, strategies, and goals, together with tools for surveillance, prevention, and control of viral hepatitis. Well, we had action, and we had action at WHO. For the very first time, a global hepatitis program was created. Out of that came a framework for global action, and since then, guidelines, first for hepatitis C screening, care, and treatment, which were launched at EASL last year, and then the hepatitis B ones in the PAHO meeting this year, the guidelines for surveillance in development, and also for hepatitis B and C screening. And as you know, with WHO, they tend to be focused more on resource-constrained countries than the more developed countries. However, that was good. We got some action at WHO level, but at country level, the progress was very slow, and we did a report with the World Health Organization that asked countries whether they had strategies, and a number of them said they did, but in reality it was very few that really had them. So this was disappointing. A couple of years after that, at the end of 2012, our case was further fortified by the release of the Global Burden of Disease data for 2010, which showed that viral hepatitis was killing as many people as HIV/AIDS and significantly more than TB or malaria. And as you know, in the latest figures from 2013, it's now killing significantly more actually than HIV/AIDS. And this was an important driver, but also our feeling that not enough had been done at country level. And at our 2013 board meeting, we had a discussion on how to push the agenda forward. And on our board, we always have someone at director level from WHO as an observer. And the suggestion from the person who was the observer then, she said, in flu, what we did is we got together a group of champion countries to really push things, a bit like we had right at the beginning. And so we decided at the 2013 World Health Assembly meeting, we would put together a side meeting. And Brazil said they would host it if we organized it, which we did. We asked Indonesia to co-chair it. A number of countries spoke. It was a well-attended meeting. And what came out of that from the countries was a decision not to set up a working group, but rather to have a new resolution. And Egypt went immediately and asked for it to be put on the agenda for the executive board, which is the first step towards a resolution. And Brazil said they would lead on creating it. And we actually wrote the first draft of this resolution. It then went out to consultation with a number of countries. It was put forward to the executive board in 2014. There were a lot of countries who wanted to change the wording a bit, and they were drafting groups every single day. So a lot of work went into this. However, what came out was a resolution, and it was supported by a lot of countries. And that there in front of you is the list of the countries that spoke out at the Assembly in 2014 to support the resolution. And as you can see, it's really from oh, something slipped off there. The last column is actually the Western Pacific region. And so from all 6 WHO regions, Africa, the Americas, Eastern Mediterranean, Europe, Southeast Asia, and the Western Pacific. Big countries, small countries, developed countries, developing countries, really a very good spread. And I have to say that that was probably the first time at a global meeting I had felt, yes, the nations of the world do finally want to do something about this. And what the resolution said, I don't want to run through this in great detail. I've just picked out a few key clauses. The very first clause really asked countries to put in place national strategies, and then asked countries to make sure that civil society were involved closely in all of that, and then to make particular provision for populations who were particularly affected, but at the same time perhaps do not have equitable access, like indigenous people, migrants, and other vulnerable groups. There was a particular section for people who inject drugs. And it also asked countries to really address stigma and discrimination. But then critically asked WHO itself to do some things. And in one of the clauses, to develop a system for regular monitoring and reporting on progress. And the second one, clause 2.7, which is one of the clauses that we wrote in and didn't get too much change. It got watered down a little bit. To examine the feasibility of and strategies needed for the elimination of hepatitis B and C with a view to potentially setting global targets. And that is really critical in terms of what happened next. Which is that WHO took this forward, and from the end of last year through this year, they have developed a global health sector strategy for viral hepatitis. And the goal of this strategy is the elimination of hepatitis B and C by 2030. And that is elimination as a serious public health issue. And that means hugely decreasing the mortality, hugely decreasing the incidence, And to do that, that means that we need to diagnose a lot of the people with hepatitis B and C and treat them. So we have in there at the moment a 90% diagnosis target for 2030 for people with hepatitis B and C. And if you think that worldwide maybe we diagnosed 10%, that's an enormous move. And then 80% of those eligible with B and C treated, because as you know, many people with hepatitis B are not suitable for treatment, don't need it. The question of who is eligible with hepatitis C is a tricky one that will be addressed through the treatment guidelines. This strategy has been widely consulted on, including public consultation, and it's got an indicator set in development. So there are actually measures to see what's going on, and there are also some interim 2020 targets. I don't want to go into too much detail because these may get changed. The strategy will go to the executive board for the first kind of look in front of about half the world go to the executive board, and then all of the countries go to the World Health Assembly. And that needs to get through there next year in order to be adopted and then become something that the world has signed up to. I just want to mention in passing at the same time the Sustainable Development Goals. As I said earlier, the unfortunate omission of hepatitis from the Millennium Development Goals, which covered the first 15 years of this millennium, they included HIV, TB, and malaria. And the reason that viral hepatitis was omitted was that the estimates extraordinarily around hepatitis B and C in terms of mortality and morbidity were based simply on infection and not on the cancer and cirrhosis that these viruses cause. And so they said, well, it's not a really big problem. However, in the new ones, we have got hepatitis in there after much advocacy and pushing by a whole group of people. But unfortunately, health is a much smaller part of the Sustainable Development Goals than in the MDGs. It's just one goal, Goal 3. And as it says there, 3.3 is by 2030 to end the epidemics of AIDS, tuberculosis, malaria, and neglected tropical diseases and combat hepatitis. Now, we had asked for them to also end the epidemics of add hepatitis to that, but we didn't get that changed. I'm not sure that it matters that much if we've got a global strategy, to be honest. So I want to sort of turn now to the World Hepatitis Summit. This was a meeting that we had felt for some time was needed. We wanted a forum where we could bring together physically all of the World Hepatitis Alliance members to meet each other for the first time and to feel part of, you know, a single movement to do something about viral hepatitis. But we also wanted to get ministries of health there. There is no real place where, there's no meeting where ministries of health go specifically to talk about viral hepatitis at a global level. And we also felt critically that we wanted a meeting where there was a public health approach to viral hepatitis. So almost all the meetings that exist are about a clinical approach to viral hepatitis. If we are going to test and treat the numbers we're talking about, we have to have a public health approach, and it will be a very different approach about how we scale this up. In the same way that HIV had to look at how to scale up, we've got to do the same thing in viral hepatitis. And it isn't just about scale up, it's also about integration, how we can make best use of existing structures, because nobody is going to put in place a brand new structure just to deal with hepatitis. The health movements are much more horizontally based now. There is a resistance to vertical programs that concentrate just on one disease area. People feel that the whole health service needs to be strengthened. And as a matter of fact, viral hepatitis fits in that quite well, because if you do viral hepatitis prevention, diagnosis, and treatment well, you are covering such a broad range of the health system, whether it's safe blood or safe injecting or infection control generally, links with cancer, the links with HIV, and so on. So what we felt based on the lack of progress from 2010 was that the theme for the first summit needed to be on the development of national hepatitis plans. And so this was agreed with WHO. And the structure of the summit is that this is something that the Alliance does with WHO together with a host government. And for the first one, it was Scotland, because they were willing to do it and have a good hepatitis C plan. And the next one will be in early 2017. It was slated to be 2016, but for a variety of logistical reasons, is actually going to be in early 2017 in Brazil, and the Ministry of Health there will host it. And we've already had requests from 2 countries to host the 2019 one, which is immensely encouraging. And for those of you who were there, I hope that it was a really useful meeting, and I hope that it was something where you were delighted to meet policymakers, to meet other people from the advocacy world, other patient groups, other patients, and that it was something that you felt is worthwhile and want repeated. And one of the things that came out of it was the Glasgow Declaration. And that's a picture of everyone holding up their cards. If you were there, I'm sure you remember on the last day. And it was important, I think, that we said this. The participants of the inaugural World Hepatitis Summit believe it is possible and essential to set as a goal the elimination of both hepatitis B and C as public health concerns. And I think that this is important, that we do adopt this as a goal, and we do use this as an advocacy tool to push governments into, and not just governments, but indeed all the stakeholders involved in this, to do more. Because really we have an enormous amount of catching up to do in the field of viral hepatitis. And one of the other areas clearly that is going to be very important is access. And at the summit we put out this statement and we asked people to sign up, and on the right hand side, it's a little difficult to see, is the scroll that has everybody's signatures on, and in front of you the text, but even that's quite small to see, particularly if you've got a small monitor you're looking at. But it basically says more people die each year from hepatitis B and C than from HIV, AIDS, TB or malaria, and the single most important reason for this is that they do not have access to life-saving drugs for hepatitis B and C, and it's not acceptable. And it really asks both government and the pharmaceutical companies to make sure that drugs are affordable and registered and available, and there shouldn't be onerous anti-diversion policies, and essentially we should have access, all of us, everywhere, because that's what's going to stop us dying. And that is being sent out to all governments, all pharmaceutical companies involved in viral hepatitis, from all those signatures. And I just want to end here because my time is up. We feel quite strongly that the summit was a tremendously important way of bringing a lot of people together. But we feel we actually need something that you might call a hepatitis movement, some kind of overarching thing that is sufficiently broad that anyone, any group, any organization, any activity about viral hepatitis feels it can sit within it. That it allows people to feel part of something and allows governments to understand there is this big movement out there that is really pushing them to do more. And you know, clearly we think that probably the way to go is to link around the idea of elimination. However, what we are doing at the moment, we just started, is a big consultation on this, so everyone will be asked to feed into this as to what we need to do. And we have a bit of a plan as to how we could take this forward, with an idea to launching it next year. And the idea is that, you know, if you are in Botswana and the one thing that you want to do is to try and get people tested for hepatitis B, you can run your hepatitis B testing campaign within this movement so that it feels part of something that's bigger, that's worldwide, and that is supported by people right across the globe. So I hope very much that that makes sense to you and you'll take part in the consultation, and that you will want to be part of this, and you will help us in setting it up and support it going forward. And that's really all I have to say. So thank you very much indeed for listening, and Hepatitis B United, thank you very much indeed for giving me this opportunity.
Thank you very much, Charles. That was really very, very informative, and I know we're generating a bunch of questions already. We will now turn to Dr. Sue Wong, who will be talking about global perspectives as the representative from the Americas region. Sue, I'm going to hand it over to you.
Great, thanks, Sherry. I am very excited to be able to speak here, and also very honored to be the board member representing the Americas region. And I just want to thank Charles for allowing that to happen, and really for making this a very eye-opening experience so far. I am serving my first of 2 years of a 2-year term, and I was elected earlier this year, and I have to say it's just been very eye-opening in terms of looking at an international perspective, and I hope that during this time this is opening other people's eyes in terms of what we can do in the Americas to make our voice heard and be involved internationally with our efforts. So oh wait, there we go. So this is the rest of the board. You have Charles as the president, and some of you who were at the summit may have met some of these other board members. And you see that all of us represent one of the regions. And we have Dr. Hernshaw, who is the director of the HIV, AIDS, and Hepatitis division at WHO, who's an observer. And we also have another non-executive board member who used to be a board member, Helen Terrell. So I have been doing hepatitis work since 2006, when I used to work in Chinatown. And I remember when we had our first World Hepatitis Day around 2010, I remember hearing about the World Hepatitis Alliance, and it sounded like this really important international group. And then I remember meeting Charles Gore at one of the White House World Hepatitis Days. And so it's been really interesting now to be on the other side and serving on the board and hearing the history of the Alliance and how it came about, and how this World Hepatitis Day came to existence because the World Hepatitis Alliance worked with WHO to make it a special day. So I think sometimes we operate on one angle and we don't understand kind of what's happened in the background to get us to where we are now. So I really appreciated his sharing the history of World Hepatitis Alliance. So one of the things I realized I was very ignorant about when I first started serving as the board member was when I met everybody on the board and hearing about which regions they represented. And these regions are not necessarily intuitive, so I thought I'd just go quickly, just kind of share what these regions are that we have. And these are WHO regions, and so the World Hepatitis Alliance follows these regions for us, and as we select people to represent these regions. So first off is the Western Pacific region. So it's not all of Asia. It's actually part of Asia, and then we have Australia and New Zealand, some other countries. And this is actually where a great deal of the burden of hepatitis B is, and in which about 50% of all hepatitis B related deaths, 50% of all occur in this region. So they actually, I remember I met somebody who, they actually have a viral hepatitis representative, a physician who actually works just on hepatitis in this region, which I thought was very impressive. All right, so next, this is the Southeast region, and obviously a lot of people are affected by hepatitis B here as well. This is the European region. This is the Eastern Mediterranean region. This is the region I couldn't figure out because it wasn't intuitive to me. So you can kind of see Egypt is one part of this region, and some other countries in the Middle East. All right, and this is the African region. And this is, here is us, America. So what was great about this summit was the opportunity to really meet our colleagues across the border in Canada and in Latin America. And at the summit, which many of you attended, it was just a very impressive representation of people from all over the world. There were 600 patients, patient advocates, policymakers, civil society, public health specialists in attendance. We represented 91 countries, and I met people from countries I had never met anybody from, like Mauritius, places I didn't know where they were on the map, embarrassingly, and then 40 governments and ministers of health who were there. And in the end, there were 76 pieces of news coverage. I don't think this counts all the tweeting that happened, with a reach of 5 million people. So this is a picture of us. This was a picture of the American delegates, and it was great. We basically convened kind of ad hoc a chance for us to meet outside the meeting, and many of us had never seen each other in person, but had heard about our groups. And I think a lot of us realized that it was very interesting to meet our colleagues across the border. Okay. Sorry, I'm having a little problem turning. Okay, there we go. So who is the Americas region? We actually represent 68 organizations. 43 are from the US, 13 are from Canada, and 20 are from Latin America. And if you go on the World Hepatitis Alliance webpage, you can actually see everybody's profile, everybody's logos, and where everybody is from. Okay, so this is all the pictures and all the logos. And as I was kind of preparing this talk, I was on the website and I realized how many resources are on the websites that the World Hepatitis Alliance has created, and it's really something I hope all of you, especially if you're members, really take advantage of. So there are 3 separate websites. The World Hepatitis Alliance itself has a website with a number of reports about the activities that we've done, technical guides, and actually infographics in different languages, which could be very useful for you in working with your populations. The second one is the website for the World Hepatitis Summit. So very recently they put on all the presentations on and if you haven't, so if you did not make it to the meeting, definitely make use when you have a chance to take a look at the presentations. The slides are there, the actual videos of the presentations are there. There was a very moving testimonies of people who are living with viral hepatitis, which is on there also. There are photos from the conference, media lounge, which has press releases, and if you actually go on the YouTube channel, a lot of the videos are you can find from the summit of all the speakers. And then lastly, there is a separate website for World Hepatitis Day, which many of you I'm sure have visited. And whenever the campaign comes out, that's where all of the posters, the infographics, logos, all the toolkits are posted, and those remain up there for the rest of the year. I think there's also a tab on that where you can look at all the events that have happened, and we do put out a report every year about what events our members did for World Hepatitis Day. All right, so this is just showing the webpage for World Hepatitis Summit, and under resources you see the media lounge, the presentations, the films, and the gallery. So definitely, take advantage of that, especially if you weren't able to make it or make it to some of the sessions that you wanted to go to. All right, and this is the World Hepatitis Alliance website, which has the infographics that I mentioned, and they're in many different languages. All right, so what are next steps for those of us in the Americas? We do want to really capitalize on some of the momentum that I felt we achieved just by meeting each other in person at the summit. And while we were there, some of our other colleagues from Mexico and Canada brought up a PAHO meeting that was coming up in the next couple weeks. And they kind of suggested that we should write a letter together to approach PAHO about viral hepatitis. And I mean, Charles will probably laugh, but a lot of us were running around saying, what's PAHO? What does PAHO do? And what is this meeting you're talking about? And, a lot of us just have not really been aware of some of the international aspects of the viral hepatitis movement. So basically, WHO has regional committee meetings, and I don't know why my slide is a little messed up here, but I'm listing all the regional meetings that have happened, and a lot of these were recently. So in Europe, they had one in Lithuania in September. The one in the Americas was the end of September. That's the one that we had been hearing about, and basically for every region they're having a meeting, and a lot of these meetings now, the recent ones have been including discussion about hepatitis. So what is PAHO? That was a question that kind of came up. And PAHO is actually the world's oldest international public health agency. It was founded in 1902, so it even predates the World Health Organization. And it serves as the regional office for the Americas of the World Health Organization. And together with WHO, PAHO is a member of the UN system. So viral hepatitis was the key topic for the 67th session of the WHO Regional Committee, which is the meeting that just happened at the end of September. And at this committee meeting, the 54th Directing Council of PAHO, so those are the people who serve on PAHO for this Directing Council, they agreed to a comprehensive regional action plan to prevent and control viral hepatitis in the region. So this plan, which is from 2016 to 2019, the World Hepatitis Alliance actually did actively contribute to the consultation earlier this year. And so what this plan does, it's asking governments to develop and implement national plans, and these plans would include integration of prevention, surveillance, treatment, and control into the health systems, expand coverage of hepatitis B vaccine, and governments will run awareness campaigns, including acknowledging World Hepatitis Day. So the adoption of this regional strategy for the Americas region really does signify an important step forward in the prevention and control of hepatitis in our region. And this is really coming off of just a general growing heightened level of interest and commitment. And we think, definitely having big events like the World Hepatitis Summit is a big part of these things happening. So at the time we were at the summit, the feeling was that it was a resolution being proposed, and we thought most likely it would be approved. And we're happy to say that it was approved by PAHO. So one of the other questions that came up as we were at the summit, and we actually convened a second meeting of the folks who were there representing the Americas just to find out what this PAHO meeting was about. And so one of our colleagues in Canada who had been active in PAHO kind of gave us a little rundown. And a lot of the questions many of us had was, well, who goes to the PAHO meetings? And somebody had said, oh, it's people from the government. Somebody had thought it was in the State Department, and therefore HHS wasn't involved. But when I looked at the actual attendees for the meeting, or the invitees and attendees who attended this 54th Council, you can see it is actually quite a number of individuals from DHHS, and Sylvia Burwell is the chief delegate. I don't know if she was in attendance, but probably people from her office were in attendance. And it's many people who are in the Office of Global Affairs as part of DHHS who are involved with this. And I think I also saw USAID in here. This is just one page. The U.S. Delegates actually took over 2 pages, but I just included this first page. So, and something else that came up when I was at our first World Hepatitis Alliance board meeting is, and I think this is a big issue in a lot of other countries, is that those of us who are doing this work, because we're as members of the World Hepatitis Alliance, because the World Hepatitis Alliance is in official relations with WHO, our organizations actually are also in official relations with WHO, and therefore also in relations with PAHO. So what I noticed, and Charles can kind of expound on this because he has a little bit more experiences with this, is that representatives of non-government organizations are often in attendance at these PAHO meetings too. So here you see like APHA was here, Federation of Hospitals, and Pharmacopoeia, and I think people who are interested in maybe some of the topics that are discussed at the meeting. All right, so this was the plan of action for the prevention and control of viral hepatitis. If you get on PAHO's websites, every document for the meeting is actually is there for downloading, and so you're able to review what was happening. One of our Mexican partners actually sent around, and I think it sent it to everybody who was at the meeting, the live webcast. So a lot of these meetings are actually live webcasts, and anybody can click on them. So this is a plan of action, and you can see it has these indicators, and I thought it's important for us to look at some of these indicators because a lot of them we recognize from the U.S. National Viral Hepatitis Action Plan, but some of them are not in our action plan and may be areas where we can really, as advocates, push our government to do more in these areas because now that this is being adopted by PAHO for all of the Americas region, we want to push our government to do more so that we can, because being a member country, we are trying to achieve some of these, follow the plan and implement this plan that PAHO has adopted. So for Objective 1, you can see that it's basically to have a structured and budgeted national strategy. So we do have our national action plan. If you look at 1.2.1, it's the indicators, number of countries with the goals of elimination for hepatitis B and hepatitis C. And you can see the baseline is 0. No countries currently have this goal for elimination, and we're hoping by 2019 at least 6 countries do. So 1.2.2, number of countries with the goal of elimination of mother-to-child transmission in the Hep B is 1. I'm hoping that's the U.S. because I think that is on our healthy people goal. All right, so for these, the next set of objectives, you can look at, you know, a lot of it has to do with screening, diagnosis, care, and treatment. And you can just kind of skim over that. For Objective 4, this is increasing and strengthening countries' capacity to develop and implement strategies for surveillance, prevention, control, and elimination. So one of the indicators would be countries that report cases of acute and chronic Hep B and C. And then what I thought was interesting for Objective 4 is the 4.2.1 is number of countries that have published a national report on viral hepatitis. And I think somewhere I saw that one of the indicators was like a yearly report, which I think is something that would be great if we had in the U.S. as well. All right, so Objective 5, I really like this indicator, 5.1.1, number of countries that implement standardized and effective technologies for Hep B patient monitoring. And I'm not sure that we are actually doing that in the U.S., so I'm curious who these other 10 baseline countries are, because I think there's definitely with EMR a lot of opportunity, but I don't know that we've implementing any kind of standard patient monitoring system. So what we did very recently is we did write a letter to PAHO from all the WHA members, and the purpose of this was to make the World Hepatitis Alliance and our members' presence known to the regional director of PAHO and all the PAHO member states. And what the content of the letter was really to express our support for the resolution to adopt the regional action plan and actually say we are dedicated to implementing this as well. So it's basically saying as we are offering our assistance as viral hepatitis advocates in carrying out this resolution and with working with our governments to do so. So this is just the first page of the letter. You can see it's in English and Spanish. And Carissa Etienne is the PAHO regional director. And at the end of it, we included all the logos of everybody in WHA who signed on. And it was basically opt-out, and nobody opted out of it. So this will be going, we haven't sent it yet, but it will be going to her and you know, basically going to PAHO and I think the directing council. So I hope that this sheds some light as to kind of where we're headed and what we've learned thus far. I hope for those of you who are listening, if you're not already a member of World Hepatitis Alliance, you can really take this opportunity to apply for membership. It's free, and it really brings you into these efforts to do more nationally and internationally. There are two types of memberships, voting members and non-voting members. So voting members, basically, this means that your organization is your primary work is involves hepatitis. So, and non-voting members, hepatitis can be a part of your work, but maybe not be the primary purpose of your organization. And you can apply online. It's very simple. And you do need to have just some documentation showing that that you have legal status and a constitution and some bylaws. And then once you submit it, then it gets approved and it gets reviewed and then approved by the board. So we really hope, I mean, we've got quite a number of members, but we hope that even more people can join us, because tackling this problem of the elimination really takes, a real movement, and I hope anybody who's involved with Hep B United, or even Hep B Task Force, or in any way is involved with hepatitis, this is a great organization to join and to be a part of. So thank you, and I think we're taking questions after this.
That's right. Thank you so much, Sue. Hi, everyone. This is Kate Morales, and I'll be moderating the Q&A portion of our webinar. So thanks so much, Sue and Charles, for sharing all of this great information and giving us a really good overview and background about the movement, the global movement to eliminate viral hepatitis. I would like to remind the audience, if you do have any questions or if you have your hand raised, if you could please, due to the number of people we have online, we will have to keep everyone muted. If you could ask your questions via the chat box, then we will be able to take them then. I do have a question for Charles that came in via the chat box, and the question is, if and I think this is referring to the global hepatitis strategy, if it's passed or adopted by the WHO Executive Board and the World Health Assembly, how will this change things?
Well, what it will do is it will mean that every country, because of the way that resolutions work, which are that they have to be unanimous, that will mean, therefore, that every country has signed up, at least in theory, to the strategy and its targets. So this is an important advocacy tool to use when you're talking to your government. And if, for example, the target of 90% of all those with hepatitis B and hepatitis C is accepted, which is the proposed target, then you can say to your government, this is what you signed up to doing by 2030. How are you going to get there? And how can we help you get there? So potentially, it's a very important tool. And actually, the strategy is a long document and contains a lot of suggestions for what needs to be done at country level. And is therefore, yes, just an extremely useful discussion point with governments.
Okay, great. Thank you. Our second question, I think, so it's for either Sue or Charles, is have any of the participating countries achieved zero perinatal transmission? Have they achieved, I guess, elimination of perinatal HPV transmission, if you're aware of?
Not that I'm aware of, no. Indeed, to be honest, some countries are definitely doing better than others, but it's actually a rather unfortunate thing happened, which was that the birth dose has been rather deprioritized since the introduction of the pentavalent vaccine supported by Gavi. So, as you probably know, Gavi is the Global Alliance for Vaccination and Immunization, and it has supported a lot of developing countries in their introduction of vaccines. And when the pentavalent vaccine came along, which included hepatitis B, they decided to fund that. And they have stopped funding the birth dose, and obviously you can't give the pentavalent because some of the other things it contains at birth. So it's generally given, it depends, let's say 2 months afterwards. And it's really the birth dose that's so important, unless you are going to test all infected mothers. And clearly that's what you would ideally want to do, but no country is actually able to do that. They're pretty good. I mean, I would say that most of the developed world is pretty good. I would say that, I mean, I don't know about the US, but the UK is pretty good. We do test everyone, but it is an opt-out test. People can say, I don't want to be tested. And if people don't want to be tested, you know, what can you do? And truthfully, when you're talking about completely eliminating something like this, what you are really talking about is over really quite a lot of years, you are bringing it down so that so few people have it that the likelihood of transmission is incredibly low. So that if your overall prevalence is 10%, and you know a proportion of those are going to be women of childbearing age, you are going to have this issue. And they're going to be people that, for one reason or another, are not tested, or their child's not vaccinated at birth, and then you get some continuing transmission. If, on the other hand, you've got your prevalence down to 0.001%, you know, the chances that you're going to have a highly viremic mother are going to be incredibly low. And ultimately, that's what happened. You have this kind of herd effect, and you take it out just because the general background population level is so low. But I don't think any single country is likely to absolutely get it to a perfect zero at the moment, where you have such movement of populations. The fact that, for one reason or another, you know, healthcare systems are not perfect. But I think that most of the, I don't know, I mean, Sue, you probably know much more about this than I do, but I think that most of the developed world have got it incredibly low.
So I don't know about the numbers in other countries, but I have to say it was very interesting to me as I started talking to more people in other countries that things that we don't appreciate, that in a lot of other countries it's not covered like by insurance, like what we have. Like the birth dose is covered here, so it's really a matter of whether the hospitals are giving it. And nationally, Charles, we're at like 9% of birth dose administration, so we're not quite there yet. But in a lot of other countries, like I remember talking to somebody in Egypt and China, like the family has to pay for the Hep B birth dose if they want it. And so even for moms of children, children of moms who have hepatitis B, I think it's changed, but there are some areas where if they want the H big for the baby, they have to pay for it on their own. So that's obviously a big barrier to total elimination.
Great, thank you. And then for those asking if you can get copies of the presentation, yes, we will hopefully be able to make them available online after the webinar today. And this, I guess, is a question for Charles. I guess, where do you see the future of the hepatitis movement? And you made a parallel to the AIDS movement, I think, in your presentation earlier. Do you see that hepatitis is going to get as much attention, or the movement is going in the direction as like historically as the AIDS movement has come this far?
Yes, I do, but then I'm an optimist, and I think that, you know, you have to remember there are 400 million people living with hepatitis B or C. That's an awful lot of people, and if it's one of those things that will gather momentum, the more that countries are pushed to diagnose people, the greater the number of people who want to advocate for access to treatment, for making sure that prevention is in place, and so on. And it will snowball. The numbers speak for themselves, and really, you know, it's unacceptable that 1.5 million people die from hepatitis B and C when we have these drugs available. Really is unacceptable. And I think that we are at the beginning, and we're nowhere near as strong as we need to be. And that's really the point of trying to put this movement together, is we need to strengthen our voice, because unfortunately, the world is a very competitive place, and healthcare is no different. And when governments are thinking about resource allocation, they will often be swayed by who has the loudest voice. And in many countries, hepatitis B and C are both tremendously stigmatized still. And this does not help. It means that people are less willing to raise their voice, to put their head above the parapet. And, you know, there's certain countries, particularly in Asia, for example, where there's really quite serious discrimination against people with hepatitis B at the moment. But the more that we advocate for this, the more that this starts to change, the more people will be prepared to be involved and to be seen to be involved. A lot of this is actually about taking inspiration and confidence from seeing other people doing something about it. And, you know, we have in the past been incredibly silent. And I guess part of the remit of the World Hepatitis Alliance is to try and change all that, to try and support the global hepatitis community to get out there. Yeah, no, I really think I am incredibly encouraged by how far we've come in quite a short time, with really very little resourcing, very little interest, certainly at the beginning. And I think partly because the problem just seems so big to so many people and they've kind of wanted to look away. But, you know, we've had 2 good resolutions. We now have hepatitis in the Sustainable Development Goals. We now have a global hepatitis strategy. We've changed a lot in a short time, and that's really the Alliance and its members have done that. This has not just happened. It's us, and it isn't anybody else. It's not the doctors, I'm sorry to say. It's not, you know, anybody else doing this. And we all need to be involved and all work together. But actually, you know, so far we've done this. But we need many more people. We need all the stakeholders pushing. So yeah, no, it's going to grow. And I think that the World Hepatitis, I don't know if you only have been to the World AIDS conferences, for example. You know, the World Hepatitis Summit will grow towards something like that because it's needed. We need a forum where we can all talk together about what needs to be done. And, you know, this is, of the infectious diseases, this, if you put viral hepatitis together, is the biggest killer. It's number 7 killer in the world each year, viral hepatitis, number 7. Don't think that can be continually ignored.
Great. Thank you for that. We do have a few more questions that have come through. And Sue, this is for you. Are there plans to have a regional WHA meeting in the Americas, something that would take place in the U.S.? I guess this is for both of you. WHA meeting, World Health Alliance meeting in the Americas.
We have not thought that far. I mean, Charles, has that? We probably haven't gotten to that point in any of the regions, right, where people have meetings just for the region?
Well, actually, one is being planned for Africa. And we have actually done one in Africa before. And we are looking at the feasibility of doing one in the Americas region. But this is very early days, and it's something we'll have to see. Obviously, you know, one of the things I said, we're all quite poorly resourced, is resourcing for things like that. I mean, clearly, you know, the summit is going to be in the Americas region in 2017, but it would be nice to do something next year.
Yes, great. Our next question is, what are your thoughts on patent laws, voluntary and compulsory licenses on Hep C drugs, and in the future possible Hep B drugs, and the cost barriers that these laws or licenses create?
it's a problem. As you saw from the slide I presented on access, that is what we want. People have got to have access. Access is obviously, quite a complex issue because it's more than just simply patent laws. It's probably the case that the patent laws encouraged pharma, because they saw there was so much money to be made there as a result of the patent laws, into such a race to get hepatitis C drugs to market that we probably have drugs quicker than if we didn't have patent laws. But if then we have them quickly but nobody can pay for them, that's no answer at all. And I think probably our view at the Alliance is what matters more than patent laws per se is, can we get access? Now, the system that we have at the moment is in many respects not a great system, but we've got to find a better system. And until we do, we've got the system we've got. So what we've got to do is to use all the available means to make sure that we get access. And that in some countries might be fighting the patents. It might be generic licensing. It might be a deal with the government with pharma, as they've done in Brazil. It doesn't really matter. What matters is, can we get access? I think probably we don't feel that we want to get too hung up on the kind of conceptual basis of whether patents are good or bad. It's just like, can we get the drugs to the people who need them now? Because so many of them are dying that, if patents are in the way, then we need to get around them. If they're not in the way, fine.
Right.
So it's
Sue, did you want to comment on
practicality
that?
ahead of concept.
Mm-hmm.
No, I think Charles knows a lot more about this than I do.
Great. Okay, and our final question before we wrap up is, what is the role of doctors in the Alliance?
Okay. Obviously, Sue is a doctor, so very important.
Yeah.
Essentially, the World Hepatitis Alliance was set up as a patient group organization. And so therefore, as one of the stakeholders, we would say perhaps, the most important, but clearly doctors have an incredibly important role. And really, when we're talking advocacy, it is critically important that doctors and patients and advocates all work together. Doctors are very often very important advisors to governments that governments listen to. But equally, when governments don't want to do something, they're perfectly happy to disregard doctors and effectively say, listen, you work for us, fine, you've had your say, that's enough. Patients, on the other hand, very bizarrely, governments tend to see as voters, whereas they don't seem to see doctors as voters. And consequently, very often, advocacy that's led by patients and patient groups and patient advocates is more effective than that led by doctors. But doctors absolutely have to be part of it. And so, yeah, they're partners.
Yeah, I mean, I think, Charles, I think it would be great if there's somehow we could get more involvement of physicians. I think on a lot of these fronts, like, even Hep B United, Hep B Task Force, we have some physician leaders, and they represent the patients, in a way. And what I didn't get to mention, but World Hepatitis Alliance has created a patient support group toolkit, and it's targeted actually for physicians to try to create focus groups. And this is really novel, and when I first heard about it, I was a little skeptical. I think most doctors are probably swamped and don't see themselves as being patient advocates necessarily. But I think this is something maybe we could test out and pilot and see if this is a way to really get physicians on board, and also to get physicians to mobilize their patients to be more vocal advocates. I think a lot of us have kind of assumed that our patients don't want to be vocal, or, especially in the Asian population, might be not willing to come forward. But something I've been challenged by other members as now I'm on this board is, well, why don't you guys have more patients involved? Why don't you ask them to be on your board? And oftentimes I just say, oh, well, they don't want to. But have we asked them, have we posted ads looking for patients to be on our boards or our steering committees? And I think that's something we should do more of.
And can I just add, I mean, the Alliance does have relationships with the big hepatology organizations. So we have a meeting, in whatever it is, a couple of weeks, 3 weeks with AASLD about how we can take this forward. AASLD have been a little bit slow. EASL, the European Association, we have closer links with already, and they definitely want to do more with this. We want to see how we can work together. And so at the EASL meeting next year, there will be in April, there will be a session on how this can work and how we can get doctors more involved in this movement. And we're looking at maybe doing something with the Asia Pacific Association too. So it's definitely an area that we are trying to move forward. But the mindset sometimes of the professional organizations is a little bit different.
Great. Thank you both for that. And I don't think there are any further questions. Thank you, folks, for sticking around a little bit over time today. But we had really great questions. If you do have any follow-up questions, please do feel free to follow up with us directly via email at connect@hepunited.org, and we'll be sure to direct them to Sue or Charles or Sherry. And here's a last slide just so you can keep up to date with Hep United. You can follow us on our website and any of our social media outlets. And lastly, I want to thank you both, Charles and Sue, so much. I know you're very busy individuals, so thank you for participating today, and thank you for your thoughts. And thank you, everyone, for connecting with us today, and hopefully you all become members of the World Hepatitis Alliance. And finally, please keep on a lookout for a message right after you disconnect today for a survey. And we would love your feedback on today's webinar so that we can continue to provide topics of interest to you in the future. So thanks again to everyone, and have a great rest of the day. Thanks, Sue and Charles.
Thank you. It's a pleasure.
Thanks again.